Module 3, the Affordable Care Act. Okay, this will be a short summary about uh, the Affordable Care Act, what it does, what has been the response to it thus far. Much of this material will also be discussed in class, but this will just be, again, just to give people a story as to what are the important points concerning it. Now, again, the point here was again trying to provide health insurance to a large number of other individuals, and so the issue being is trying to get people connected. So some of the things that they did, in addition to the mandate around health insurance, was to increase the access or increase the building of community health centers, the expansion of the National Health Service, and providing health service to rural areas. And one of the other aspects which you may or may not have heard about was that younger people will be able to stay on their parents' health care plans until the age 26. That was one of the first changes that was made when the law was implemented in 2010, and we can really see some of the changes that resulted from that. So when we're talking about the Affordable Care Act, we're not just talking about just one thing. There are numerous other little aspects, again, with the goal of trying to provide additional services to a greater number of people. And the mandating of health insurance to much larger individuals, the providing of healthcare credits was just really one step, one part of a larger whole in trying to improve people's access, especially the access of people, poor people and people in rural areas. Now, part of the debate has been it was the behavior that many insurance companies were playing in regards to people's access or people's utilization of health insurance. People have found that their coverage were canceled because they became sick or because their illness really started to cost too much money. Uh, the so the law sought to prevent some of these abuses. So one of the major changes that occurred was that health insurance companies can't cancel coverage and they can't cap the dollar amount that people can seek reimbursement for. Previously, there have been lifetime limits for coverage, and with many healthcare problems, especially with cancer, many people hit that cap very easily, and so the healthcare law did away with that as well. And so it provided more support for people who are for purchasing health insurance or accessing health insurance through the employer. New ways to appeal, new protections. Okay, this is an issue that was fought against by the health insurance companies, but because of the individual mandating everyone uh, needs to have health insurance, the health insurance companies were able to support this because then the risk in dealing with those who may be using health insurance far more than usual, they'll be supported. The risk would be reduced from the larger pool of people paying into the system. And this is an individual mandate. This is probably the most common thing people think about when they think about the Affordable Care Act. The Care Act. That is, people have to have health insurance. Now, every citizen, every legal resident to the United States have to have health insurance, either from their employer or they need to purchase it themselves. There's some limitations. Incarcerated individuals were exempt. Non-citizens, uh, undocumented persons were exempt. Um, but for everyone else, they need to get health insurance. Currently, for those that don't, there is a penalty. Penalty in the early years has been pretty minimal, but the goal here is to increase the penalties until a point where it becomes much more problematic for people to be without health insurance. And these penalties come into play when people do their income tax every year. to encourage people purchasing health insurance. Again, for those who can't get health insurance from their employer, they need to purchase it from the open market. To help people purchase health insurance, part of the Affordable Care Act also included subsidies for individuals. So up to people who earn a certain amount can seek to have a certain amount uh, provided to them to support the payment of their premiums for their health insurance. And again, this benefit came about or would arise when people do their taxes every year. Another important aspect of, about the Affordable Care Act was the expansion of Medicaid. That is, their goal at the time was that to have every state expand Medicaid to those earning less than 133% of the poverty level, so that any individuals who were not eligible for Medicaid at the time would become eligible. And so you would see larger individuals, the working poor, uh, low middle incomes could have access to it. And again, for everyone else, they receive a tax credit to help support their premiums. So there was a lot of money coming from the federal government to help support individuals to access health insurance in a number of ways, either from Medicaid or in the purchase of healthcare premiums. A lot of other factors that go into this is uh, additional regulations for employers, mandating employers of a certain size to provide health insurance to their employees. Um, those that do not, again, would be seeking a penalty. Again, a lot of those aspects were other ways in which they went to try to fund the system. And again, with everything else, there have been a lot of criticisms on both sides. There were a number of people that felt that this didn't go far enough, that there were a number of people who preferred or wanted to see a single payer system or even a public option for individuals to purchase outside of the private health insurance market. But again, those weren't seen as being politically popular and weren't popular with the healthcare industries, and so those weren't implemented. Much of the discussion, again, much of what we will be discussing in class, is how does one view healthcare? Is healthcare a right, or is healthcare a commodity? Is healthcare um, what everybody in a free country has to have access to, or is healthcare like a TV or a car? And if you start looking at the debates, you'll see how different groups tend to see healthcare in different ways, and how this influenced the debate regarding healthcare reform. Some of the challenges that people are making regarding the Affordable Care Act is in regards to, does the Affordable Care Act impinge on religious rights of employers? Specifically in regards to the provision of contraception or sterilization services, basically birth control. Uh, there's a number of individuals, primarily church-affiliated organizations, who felt that in providing or providing insurance that covers these things went against their moral code. And other employers, other companies who are actually not specifically religious, also started making the same argument. So you see, in some cases, or see ways of ways the administration try to find ways around it to accommodate uh, church organizations in regards to their moral code, but at the same time still allow their employees to have access to the health care that they need. There are a number of significant Supreme Court challenges to the Affordable Care Act, each having a different outcome and each having a different impact on the Affordable Care Act. The two notable ones, the first one, the National Federation of Independent Business versus Sebelius, who was the director of the Health and Human Services at the time, Kathleen Sebelius. what they found was they were focused specifically on whether the individual mandate, whether that was constitutional, the idea that individuals have to purchase health insurance, and also can the United States force states to expand Medicaid. The results being mixed. They upheld the individual mandate, identifying it as part of the taxation powers of the United States, but stated that the government could not force states to expand Medicaid. The result being, again, a number of states expanded Medicaid, many states did not. And that's going to have an impact on health outcomes for a number of years, and we can actually start seeing some of the effects that's having. Another court case, actually very recent, King v. Burwell. This was on the idea of whether or not the federal government can actually provide credits for the purchase of health insurance. And this was a very technical court case focused on the specific wording within the Affordable Care Act. At this time, people were sure that if the Supreme Court ruled against this, this would have gutted much of the Affordable Care Act and we would see a lot of problems resulting. But the Supreme Court ruled for it and allowed for the government to be able to provide credits for the purchase of health insurance. Another Supreme Court case regarding the Affordable Care Act is referred to the Hobby Lobby ruling. And what was stated here was that, again, because you have a corporation with a small number of shareholders sharing a common religious morality, that they should not be seen or should not be forced to provide contraceptive care as part of the health insurance package because it violated their religious freedom. As a result, this led to the federal government finding other ways to provide these services to employees so that the employers don't have to be involved in the process. However, this issue is still very much under debate and still being brought about in various court cases. So this still remains a very contentious issue. But here we can actually see really a debate between two different types of policies. One, seeking to provide health care to a large number of individuals, comprehensive health care to a large number of individuals, but how that deals with other policies seeking to provide support for people's freedom to express their religion. The future of the ACA, while for the most part has survived a number of Supreme Court challenges, can still be pretty debatable, depending on who's currently in power at the federal level, who will be our next president, how will others respond to a lot of the other activities regarding the law, other court challenges, and so forth. So we still see a lot of shifting regarding what the Affordable Care Act can do, how it needs to respond to challenges, and how can it seek to change to accommodate the other unforeseen consequences that have been arising regarding it, and while at the same time working to provide greater access to health care to a larger number of individuals.